Hello, everyone. It is Veterans Day here in the United States, and we would like to say a happy Veterans Day to all of our veterans joining us today. We are grateful for your service. I am Dr. Gina Friel. I am a pediatric nurse practitioner, and I am director of the Global Nurses Working Group at Columbia University Mailman School of Public Health. I welcome you today to session 7 of Nursing on the Front Lines of the Climate Crisis, Strategies for Advocacy and Action. Today, we are joined by two amazing speakers, Dr. Ashley Moore and Dr. Stella Bialous, and we are going to be talking about cancer, and we are so happy to have them joining us today. Let me see. I'm going to share my screen, and I am going to say a great thank you to our course partners. And they have been a great source of energy for this course. And we are grateful to them for joining us on this journey of this course, Nursing on the Front Lines of the Climate Crisis. And I believe I am ready. There we go. We are so pleased to offer closed captioning for this session. Please click on the link that is going to be available at the bottom of your screen. Spanish captioning is also available. This is our course schedule, and we are on session 7. These are our course partners. We are all here today to increase our knowledge and self-advocacy, to improve our communication, and to develop improved strategies for advocacy and action related to the climate crisis. Individual attendance is automatically recorded during the live Zoom sessions. Please join with your own individual link and not with a colleague's link. Our sessions are all being recorded, and the sessions will be available indefinitely on the Alliance of Nurses for Healthy Environments learning platform at learning.envirn.org. Here are some helpful QR codes. If you are a first-time user, the code on the left is for you to join the learning site. All of our asynchronous sessions will be available there. And if you have been to the learning site before, you can go to the QR code in purple on the right, and you can link into all of our previous sessions. All 6 of them are now available on that learning site. There will be a final exam. It will be 20 multiple choice and a combination of multiple choice and true false questions. It will be available from December 2nd, which is our final session, through December 6th. We request that you take the exam in one sitting using the same email address that you signed up for the course, and the exam link will be sent on the final day of class and via email, and it will also be available on WhatsApp. We will not be reissuing the exam after Saturday, December the 6th. Certificates of participation will be awarded to participants who attend at least 7 out of 10 of the live Zoom sessions or view the recordings on the Alliance of Nurses for Healthy Environments learning platform shown previously, and also you passing the final exam with a score of 70% or higher. In the United States, continuing education, or CE, will be available to all United States participants. And in order to receive the CE, and one CE is available per webinar, participants must have attended the live webinar sessions or view the recordings at a more convenient time in your location asynchronously and receive at least an 80% on the post-session evaluation. And you do not have to complete the CE process in order to receive a certificate of participation. For those who have attended the live sessions, the passwords have been sent from the Global Consortium on Climate and Health Education email address. If you watched at least 45 minutes or more of the live Zoom session, and these are all of the dates that those codes have been sent out. So please check your email boxes and also check your spam folders, as we know sometimes things get lost in there. Today's session will be 60 minutes. This session will end with a question and answer segment for our speakers. We request that if you have a question for our speakers that you place it in the Q&A and not in the chat. The slide decks and the resources will also be available on our course website following the session, as well as the video recordings on the Alliance of Nurses for Healthy Environments website. And those links we are going to place into the chat. And so now it is my pleasure to introduce our two speakers. Our first speaker is going to be Dr. Stella Bialous. She obtained her BSN from the Federal University of Rio de Janeiro in Brazil, and she obtained her master's in science degree from Johns Hopkins University School of Nursing and her DrPH from the University of California, Berkeley School of Public Health. She has over 35 years of experience in cancer control with a focus on tobacco and control policies. She is currently a board member of the Union International for Cancer Control and has served as the president of the International Society of Nurses in Cancer Care. She is a professor in the Department of Social and Behavioral Sciences of the University of California, San Francisco School of Nursing. It is also my pleasure to introduce Dr. Ashley Moore. Dr. Ashley Moore is an oncology nurse and climate researcher at the University of California, San Francisco, and a current fellow with the Global Consortium on Climate and Health Education. Originally from a rural farming community, she brings a grounded understanding of the barriers to equitable healthcare, which has shaped her work across oncology, women's health, and global disaster response, including supporting women in rural Pakistan during climate-related emergencies. Her current research examines how disaster-driven displacements impact women's health, community recovery, and access to care, with a broader commitment to strengthening continuity of cancer services during climate-related disruptions. Outside of her academic work, she recharges by hiking in the redwoods, traveling, and playing the mandolin. It is my pleasure to introduce Dr. Ashley Moore and Dr. Stella Bialous. And Ashley, I will hand it over to you.
Okay, thank you so much, Gina. Bear with me, everyone, as I prepare to share our slides. And please continue to post where you all are joining us today from around the world. It's so exciting to see. Okay, can you all see my slides correctly? Okay, awesome. Well, thank you, Gina, for that kind introduction. And I'm so thrilled and delighted and truly honored just to be joining all of you today. I'm really inspired by this course and by this group of really global nursing advocates. And today we're going to be looking at how climate change intersects with cancer care and what this means to all of us as we navigate our roles as clinicians, but also as nurse advocates, and also how we navigate our own health comes in this ongoing changing environment and changing world. And I want to acknowledge that talking about cancer is a deeply personal issue for many of us, whether we're dealing with a personal diagnosis or a diagnosis of a loved one, or just we've seen how this impacts the communities we work with. And so when we talk about climate change and cancer, we're not just talking about the environment. We are not just talking about cancer, but we're really building upon a lot of the issues that we have talked about in this course so far, because this truly is an environmental justice issue. This is a nurse advocacy issue. It's a health equity issue. And so and it's also a rapidly evolving area, both in research and in practice. And the exciting part of that is that nurses are really leading in solutions. So I just want to kind of advance kind of with all of that in mind. Okay. And before we get started, I just want to acknowledge that, sorry, bear with me just a minute. Let me minimize this. Okay. I'll just note that we, as the presenters, have no conflicts of interest to report in what we're discussing today, but our goal is just to share evidence and examples that support nursing advocacy and clinical decision making. Okay, so here's just a brief overview of kind of where we're headed today. I have the privilege of kicking us off and talking about kind of the global cancer landscape. Um, and then we'll talk about kind of making the connections between climate change and cancer pathways globally. We'll also talk about how climate-driven disasters are impacting access to care, as well as exacerbating already existing global disparities in oncology. And Dr. Bialous is going to speak to tobacco, cancer, and environmental harm, as well as nursing leadership and action. And of course, we're happy to take any questions at the end, and I hope you guys continue to ask those in the Q&A chat. Okay, so just to ground us, I'm not going to go through all of these, but these are our learning objectives for today. And by the end, really ultimately, our hope is that you'll have a better understanding of how environmental and climate conditions are shaping cancer risk and care access. Okay. So just to begin, I'm going to set the stage here with a few statistics, just looking at the global cancer landscape. And real quick, before I dive in, I'm just going to ask if everybody can remain muted. I would really appreciate that. And so glad again, everyone is here. Um, so these statistics kind of speak to where we are now and where trends are heading globally. And I want to acknowledge that a lot of these statistics are very daunting. But they also speak to why we have dedicated an entire session to talking about the intersection of cancer and climate change. And so most of these statistics come from the World Health Organization. But to kick us off, this first statistics, there are 20 million new cases and 9.7 million deaths from cancer worldwide in 2022. And of course, cancer remains one of the leading causes of death worldwide, with 1 in 6 deaths. Most of these are contributed to lung cancer, breast cancer, and colorectal cancer, which are together comprise 1/3 of all new cases each year. And I should mention that, the landscape is really changing in terms of ages that these cancers are presenting in, because colorectal cancer used to present more heavily in aging populations. But as many of you may know, recent years have shown an increasing incidence of colorectal cancer in younger populations. And this is due to a lot of different factors, including dietary patterns, disruptions or changes in our gut microbiome, an increase in sedentary lifestyles, and as we're going to be talking about today, environmental exposures that are shifting risk earlier in life. And of course, while we're making advances in cancer care, which are very exciting and give me a lot of hope, these, global incidence is also worsening. And so this next statistic is pretty daunting. By 2050, new cancer cases are projected to reach 35 million annually, and this is a significant increase over the next 25 years. And this last point here is one that we will speak to more in the upcoming slides, but um, people in lower human developmental index countries really are going to be most heavily impacted by this. They're more likely to die from cancer, despite oftentimes having a lower incidence. And as we'll talk about in upcoming slides, this is largely due to limited access to screening and treatments. And so, it tells us that this is not just a clinical issue, but it's a systems and an equity issue as well. Okay. And this figure, I just want to start by acknowledging it's a little outdated. This is from 2018. So it's 7 years old, but I just want to acknowledge that many of these trends are still relevant and continue today. And what stands out here is how unevenly the burden of cancer appears by region. And so, as we can see with the purple, nearly half of all new cancer cases occur in Asia. And that's not because cancer risk is necessarily higher there, but it's because Asia is home to about 60% of the world's population. And so population is one of the key drivers behind this. But meanwhile, regions like Africa and Oceania show a smaller share of the total cases. But this doesn't mean that the burden is lighter. So it's really important to distinguish that. And, um, when we look at this, it's not just about where cancer occurs, but it's also about who has access to early detection, who has access to quality treatment and survivorship care. And so, even though the burden is global, the ability to respond is not always equal. And so, this chart helps us to recognize that. Okay. So, with that context in mind, I kind of want to dive in and talk about how climate and environmental exposures fit into this picture. And I like how this picture kind of makes it very clear, even though it's to some extent an overly simplified version. It's definitely not representative of all of the causal pathways between climate change and cancer. But it does show how the environment and cancer are deeply intertwined. So this figure shows that that climate change affects cancer not just through the environment, but also through the systems that we depend on to prevent, detect, and treat disease. And it also shows how climate change influences cancer not only through increased exposure to environmental hazards like air pollution, contaminated water, wildfire smoke, but also through disruptions to healthcare systems during times of disaster, during times of extreme heat, storms, or flooding. And of course, we'll break that down and talk about that a little more in depth in the upcoming slides. Okay. So the next two slides are kind of going to break this down like I talked about. Um, but I really want to take a moment to talk about how climate events can mobilize carcinogens in ways that increase exposure for already vulnerable communities. And for anybody who's not familiar with a lot of the terminology that we use in cancer or in oncology, carcinogens are substances or exposures that can increase the risk of cancer by causing changes or damage to our cells. So they can, increase our risk of developing cancer throughout our lifetime. And the first point here, I'll go through about 6 points. The first point is fossil fuel combustion and diesel exhaust. So when we burn fossil fuels like coal, oil, and diesel, the fine particles released, also called particulate matter, can travel deep into our lungs and our bloodstream. And these particles are linked to an increase in lung cancer and other types of cancer. Diesel specifically is linked to an increased risk for bladder cancer. And an example of this can be seen in a lot of larger cities that experience heavy traffic congestion. So, whether it's Los Angeles here in the US or New Delhi, Lagos, we tend to see higher rates of pollution-related respiratory illness as well as cancer rates because millions of people breathe this air every day, and it's extremely harmful for their health. The second point here that I'll talk about is wildfires and extreme storms. And so um, wildfires, sorry, and extreme storms don't just cause immediate damage, they release harmful carcinogens into our environments. So benzene, formaldehyde, and heavy metals are just a few that I mentioned here. And these, an example of this can be seen in recent wildfires here in my home state of California over the last decade, but also we're seeing more and more wildfires globally. The bushfires in Australia, the wildfires across Greece and Chile. And all of these are examples of how smoke has traveled thousands of miles, exposing communities even far from the flames. And this shows how climate-driven disasters can spread cancer-linked toxins across entire regions. So it's not only harming the communities directly impacted by these disasters, but have long-reaching consequences. And then the final point here is rising UV exposure and atmosphere changes. So this is a biggie because as the climate warms and the atmosphere changes, and these conditions shift, we are seeing higher UV exposure, and which is contributing to global rise in skin cancers. So skin cancer now accounts for roughly 4 to 5% of all cancers worldwide. And a lot of countries are doing a really good job of, integrating policies to kind of combat this. However, there are still a lot of existing gaps globally. But I just want to give a shout out to countries like Australia and South Africa who have integrated sun protection into their schools and their workplace policies to help kind of better protect communities who are vulnerable to this. Okay, moving on. And so the next couple of points really speak to environmental carcinogens that are really spread through times of natural disasters. The first one mentioned here is chemical mobilization during climate events. So when disaster strikes, like floods, hurricanes, or industrial fires, these can mobilize chemicals stored in factories or pipelines and rail systems. And these spills can release harmful substances that leach into our soil and also into our water supply, which kind of takes us to the next point here, water contamination. So climate-driven droughts and floods can increase harmful toxins within our water supplies, such as arsenic, nitrates, and nitrites in our drinking water. And long-term exposure has been linked to different cancers such as bladder cancer, skin cancer, and stomach cancer, just to name a few. And an example of this globally is in Bangladesh and parts of India. These areas tend to have a higher level of arsenic, oftentimes in their groundwater, due to seasons of ongoing drought. And so, climate shifts, these examples really speak to how climate shifts can turn everyday water sources into cancer risk pathways, especially where testing and treatment systems are limited. And of course, this final point is one of the key takeaways because vulnerable populations face compounded risk and, due to combined climate and carcinogen stressors. Okay, I want to take a minute here, and I don't have access to the chat right now, but I want you to just think about how you have seen the link between environment or climate conditions and cancer risk or cancer care in the regions or the communities in which you live. And this could be something in your clinical practice, it could be something in your community. it's very personal, but if you feel like sharing, it could be something in your personal life or in your family life. So I just encourage you to share those in the chat. And Gina, maybe if you could read a couple, that would be awesome. But one of the things I love about this course is that we all learn from each other. And so I kind of want to kind of us to kind of think about how this applies to our personal lives.
So yeah, if everyone can put any comments in the chat, I would love to share them with Ashley. Regarding where have you seen the link between the environment or climate conditions and cancer risk or cancer care in your area? We have people here from all over the world
Mm,
today, and someone just said that they have seen lymphoma and use of
mm.
pesticides in agriculture.
Yeah, that's a big one. Thank you for sharing. Yeah.
Yeah, we have people here from India, Sri Lanka, St. Vincent and the Grenadines, and
Mm,
I'm sure all of these communities are, not immune to
right.
many of the things that you're talking with us about today, Ashley.
Absolutely. And if you guys don't want to share right now, that's fine. I just encourage you just to kind of think about these in your own lives, in your own context, in your own work environments. Um,
We have someone else who says that they have seen increased UV or ultraviolet rays and melanoma.
absolutely. Thank you for sharing, everyone.
Oh,
All right.
we have one more,
Oh,
Ashley.
okay. Awesome. Please keep
Bladder,
sharing.
sure, bladder and kidney cancer with patient as young as 30 years old.
Mm,
That person sharing that comment is from Montreal, Quebec in Canada.
okay.
And then we have someone else from Canada who's also sharing there is an increase in colon cancer in people in their 20s and 30s.
Yeah. Yeah. I mean, these facts are changing ongoingly and they're very daunting, but I thank you, everyone who shared. I know these
There's actually,
experiences are deeply personal.
there's actually two more.
Okay, keep them coming.
Their comments are coming. All right. This person is saying that they have a friend with colon cancer stage 4 diagnosed in their late 20s.
Mm,
There is also someone sharing that the impact from chronic stress from climate events and outcomes adding to increased oxidative stress and cancer.
mhm,
And then I think our final comment for the moment is cervical cancer in a
mm.
woman 30 years of age. Oh,
Oh,
we have one
goodness.
more.
Okay. Okay.
Casework where the client presented with skin cancer due to prolonged sun exposure.
Mm, okay.
Oh, I have another one. An accident in the Ukraine happened with a high level of radiation, and the cancer rate was also increased
Mm,
from the Chernobyl accident.
yeah, right. That was a huge disaster with ongoing consequences that we're still seeing today. And I thank everyone for sharing. I know all of those examples, and I encourage you. I'm going to move on, but I encourage you to keep sharing in the chat because again, we all learn from each other. And these exposures and these experiences are diverse, but it does show kind of the breadth of this, how relevant this is in all of our lives. It's something that we have in common. And so I thank you all for sharing and those deeply personal experiences. But, as we move on, I just want to highlight that exposure is only one side of the story. And so I kind of want to shift gears a little bit and talk about delays in diagnosis and treatment, which is another side of the story. And climate change is also affecting the systems that diagnose, treat, and support people living with cancer. Um, and so climate disasters like hurricanes, wildfires, floods, affect cancer screenings, and treatments among those and those services are often the first ones that are interrupted in times of disasters. And I also want to acknowledge this last point here that recovery takes much longer for rural and low resource communities. And of course, disruptions don't just happen at the clinical level, they also happen across supply chains, which many of us who work in oncology or work in the hospitals or clinics can testify to. Oncology depends heavily on supplies and equipment that are often have single or centralized suppliers. So one disaster can disrupt national supply chains. An example of this that I remember was from the 2017 Hurricane Maria in Puerto Rico, which led to a nationwide IV fluid shortage. I don't know if anyone in the US remembers that, but this really showed the system fragility and our dependence on these single supplier systems. And it also reveals how fragile cancer care systems are to climate shocks and climate disasters. Okay, and then beyond supplies, cancer care is also heavily dependent on reliable electricity and temperature control, especially for medications. Many cancer drugs require continuous refrigeration. Power outages from storms or heat waves can render medications unusable within a matter of hours. And of course, this not only harms our patient populations, but can cost a lot of money for our hospital systems as well. And backup generators are awesome, but they are not always reliable, especially in smaller or rural hospitals. And then when infrastructure breaks down from floods, storms, or power loss, patients can lose access entirely. And this is a huge point. And an example of this can be seen in the central coast of California. And there are many global examples, but this is just the one I'm going to speak to today. In 2023, due to torrential rainfall, it led to the mass flooding of two communities in Central California, Pajaro and Watsonville, California, which displaced nearly 3,000 residents. And it also resulted in lost medical records and access to follow-up appointments among cancer patients. And a lot of the things we're talking about today are also relevant with other chronic diseases as well. This isn't only relevant to cancer. And so these disruptions have long-term consequences for these communities. And someone, when they were sharing, spoke to the long-term impacts of stress. And there's more and more research coming out about the link of stress in cancer. And that is a huge point. And I really thank you for bringing that to light because I don't include that in the slides here, but that's definitely an important issue to talk upon. Okay. And just in wrapping up, I want to speak a little bit before I pass the mic to Dr. Bialous, but I want to acknowledge the global disparities in oncology and climate impacts. And so these are not isolated events, but when we zoom out globally, we see that climate impacts cancer care most in places that already lack oncology resources. And so this next statistic here is pretty daunting, but 70% of cancer deaths occur in low and middle income countries where only about 5% of global cancer resources exist. And so it's really oftentimes a crisis within a crisis within a crisis. And climate shocks overwhelm systems that already have limited infrastructure to start with. So it's really a great injustice and something that I think is really important to shed light on. Okay. And then this creates a double burden, like I kind of touched upon. Countries with the least infrastructure often face the highest climate stress and non-communicable disease burden. So countries most vulnerable to climate change already have high burdens of non-communicable diseases like cancer, but also diseases as well. And when disasters strike, funding shifts to emergency response, and chronic disease often becomes deprioritized. And so, like I said before, this kind of creates a vicious cycle, rising need and also shrinking capacity at the same time. And I just want to acknowledge that oftentimes indigenous, rural, and displaced populations are most impacted. During times of climate disasters, entire communities can be displaced and oftentimes have to travel long distances with limited transportation that restrict access to cancer care. Geography, cultural safety, and displacement also affect continuity of care. And so, as we think about solutions, we must be thinking about solutions that are equity centered and community grounded. Okay. And I just want to, I know Dr. Bialous is going to speak more to this, but I want to just mention in closing a few implications that these have for nursing practice. First of all, integrating climate and cancer education into our nursing curricula is huge. This is something that, as I think, a global nursing community, we are really behind on. And I think this is starting to change, and we're making a lot of progress in this area. But I want to take a moment just to plug a little opportunity. If you work in nursing education anywhere in the world, I encourage you to take a moment, about 5 minutes of your day today or sometime this week, and complete this QR code here on the right will lead you to a nursing survey that is run by the Global Consortium on Climate and Health Education. And it's kind of tracking globally climate education that is being addressed in nursing curricula. And it will be the first baseline that we have, and seeing kind of the gaps where we're, educating currently on this issue around the world and where we're not. And then other implications for nursing practice include strengthening disaster preparedness to maintain oncology treatment and medication continuity during times of crisis. And then finally, to lead equity-focused, climate-resilient cancer care through interdisciplinary collaboration and global partnerships. And I know one of the upcoming sessions is going to be speaking to this, and that's really exciting. And so I'm looking forward to that. But I am going to hand the mic over to Dr. Bialous at this point, who is going to be speaking to tobacco, cancer, and the environment. And I thank you for all of your time today, and happy to take any questions at the end.
Thank you, Ashley. Hello. Okay. Can anybody hear me? I think, okay, yeah, we just cannot see me. That's okay. So thank you everybody for having me. I will switch a little bit. Sorry if everybody could stay on mute for a few more minutes, and then we'll give time for questions. I just want to highlight a couple of things following up. How are we tagging this tobacco into this cancer environment? For one thing is that when we talk about, we've been talking, or you all been talking for this past several weeks on climate, and it's not happening in a vacuum. It happens mostly with an increase in some corporate activities. Another area that I study is the commercial determinants of health, and we see that one of the impacts of the commercial determinants of health is climate and climate related. We all know a lot about tobacco. I'm sure you all do know a lot, but I'm just going to do one quick refresher that tobacco causes 7 million deaths a year, and over 1.5 million of these deaths are actually for people that don't use tobacco. So if you think about polluting the environment, sometimes our own household or workplaces environments are polluted by people who are smoking tobacco next to us. And, that's why it's so important when nurses engage in promoting smoke-free environments. We are already promoting a change. It causes over 20 different types of cancer or subtypes of cancer. We all know about tobacco and lung cancer, but there's many, many, many other types of cancers that are causally caused by tobacco. And it costs the world over 1.4 trillion a year. I know trillion sounds like so much money, but it is. So the cost of treating people with tobacco-related diseases and the cost of people being too sick to work adds to that much. There are over 1.3 billion people in the world that use tobacco, and the majority of these people are in low and middle income countries. So combining with Ashley just said, we see that there are countries have less infrastructure and fewer resources do carry a much heavier burden. On the graph here, I want to show that there are some good news, that we are seeing a decrease in tobacco use across the world. It's a little more flat than we like it to be. We like the curve to be a little sharper. And if you see among women, which is the yellow line, it's really, really plateauing. And this could be like, that's an epidemic that we can act to prevent right now. Next, please. Thank you. So what about the environment? Well, it turns out that we have been studying the tobacco harms from the environment. And somebody here already mentioned, for example, the use of pesticides and cancer. And tobacco crop is actually one of the heaviest users of pesticides. It's a very heavy use, which really not only damages the soil and the waterways under the soil and contaminates that, is a very high risk occupation exposure for individuals who are using pesticides. And so we do know that across the production chain, from the tobacco plant to the discarded cigarette butts, there is harms to the environment. And it amounts to over 84 million tons of CO2 every year, which, this WHO report would be equivalent of 280,000 rocket launches, if you consider. And if you think about it, this is not a crop that people use for food, is not sustainable, it's not for sustenance. It's a profit creating for a very small group of corporations. So it's like, this is something that it seems like we should really, as nurses, be engaged in supporting, work towards ending this harm, not just to people, but to the environment. It has very heavy water use and also a very heavy water contaminant. Not just the discarded cigarettes and tobacco products end up in our waterways and contaminated the waters, but during the processing of the tobacco leaves, a lot of water is used, and that water is full of chemicals and nicotine and also end up back into our waterways. There's an estimate that trillions of cigarettes butts are discarded every year. So I want to encourage you after today, when you walk around next time, when you walk to work, or if you're walking to the market, or if you're just walking to a park or going to some leisure activities, just look around and see if you can identify discarded tobacco on the ground. And the important thing is that these are, at least 70 cancer-causing products that are leaching into our soil and into our waterway. And there has been experimental studies showing that fish get sick and die from being in the water where cigarette butts are discarded. So again, we just need to assess more of the impact on humans, but the theory and the biological rationale for that impact already exist. Next, please. Yeah. So this is some of the work we have been doing, and one of them is, hold the industry accountable. This is, again, caused by a very small number of actors that are making an enormous profit at the detriment, not just of people's health, but also the Earth's health. One of the ideas that will be discussed next week by about 183 countries at the Conference of the Parties is banning filters in cigarettes. It turns out that filters, as much as many people don't know this, do not protect the health. They are not have any health protections for having filters. So banning them not only may encourage people to quit, but it also will reduce the harms to the environment. It's one of the most discarded items in litter items in the globe. And that's what I'm saying. If you start walking around and start paying attention, you'll be surprised by how much tobacco product waste you will see all around you. And we'll probably never stop to wonder what's happening to this waste. Well, it's happening, it's contaminating our soil and waters. Another idea is to hold the industry account is just ban the use of single plastics. We are seeing this a lot now with those e-cigarettes who are disposable. An abatement fee, which is something that where I live in San Francisco's try, where the companies pay the city an extra fee. It's not a tax, it's an extra fee to support cleanup. It's not ideal because you still have to do something with all the toxic waste that you collected, but at least it's not leaching into our waters and soils. And implement some sort of producer responsibility. And I really want to urge us as nurses to start engaging with the group of civil society that are trying to implement some accountability measures, not just because it will benefit our patients and communities, but also our environment. And I think that's all I had. Nope, there's more. Oh, there we go. I anticipated myself. So this is some ways in which nurses can engage in trying to minimize or mitigate this environmental harm caused by tobacco. First of all, we can also support our patients quitting. One less person that is using tobacco is one less person that is discarding tobacco in the environment is good for them, is good for our planet. We can really engage to support these policies that reduce consumption because, again, reducing consumption will reduce the demand and the supply, which eventually will benefit. Let's make sure we think about tobacco when we think about environmental harms, particularly tobacco product waste, post-consumption waste. Engage with the tobacco control communities and groups in your countries or your communities to support some of these measures that address environmental harm, including the ban of filters and the ban of single-use plastics. And let's continue to do research to really strengthen our knowledge of the link between human health and environmental harm. We already know a lot about the environmental harm. And again, the theory and the biology behind human health is there because we are consuming, the leaching of these chemicals in the water and soil that eventually we consume. I think now this is it. Yes, and these are some references. Thank you, everybody. And I see that questions will be in the Q&A.
Thank you so much, Drs. Moore and Dr. Bialous, for that really wonderful presentation and all of that information on what we as nurses can do. We have some questions in the Q&A, and I would love to share them with you both. And so I think this is maybe more for Ashley, or maybe Dr. Bialous can also say. One of the questions was climate disasters like wildfires and floods and extreme heat can interrupt cancer care, as you discussed in your presentation. And I'm wondering if you can share what lessons we can take forward to make oncology care more resilient in the face of an increasing amount of heat and extreme weather, and just maybe some suggestions that you can provide us. And whoever would like to take that.
Absolutely. I'm happy to kick us off. And then Stella, I'm sure you have a wealth of knowledge to share as well. But this is such a good question because, and it's an important one, it's a timely one, because we're seeing an increase in global climate-driven disasters. And it's impacting all of us, no matter where we live, from the west coast of the US where I live, that's being impacted by flooding and wildfires, to the hurricanes of the east coast and the southern coast of the US. And then globally, of course, we're seeing a number of climate-driven disasters. And, it's not an easy question to answer, but I think the key is investing in prevention and investing in systems to better prepare for these climate-driven disasters. And this is an exciting role that nurses can play, because we know our communities, we know our patient populations. Sometimes we have those deep personal conversations with our patients, and we see the ways that they're impacted by these climate-driven disasters, or even by climate change in general. It doesn't have to be disaster related, in the ways that maybe other, providers don't always see. And so I think we need to advocate for our populations. But I think if we can plan ahead of time before the crisis starts, that is key. And this is something that I think it depends on what area of the world you live in, what climate impacts are affecting you most, whether it's flooding, whether it's wildfires, whether it's drought, whether it's heat waves. You all know your environments the best and can advocate for your communities. And so I encourage you to think about that even today, before, heaven forbid, you're impacted by a climate-driven disaster. Think about how your patient populations would be impacted if disasters were to hit tomorrow. Think about the gaps in care that would exist, and how you can best, advocate for your patient populations and help to prevent that. So I don't know, Stella, if you want to speak more to that.
No, I think preparedness is really the key, and it's one that is sometimes systems are hard pressed to spend the funds or dedicate the priorities, because you don't know when it's going to strike, so it's always the competing priorities. But I think the other thing that as nurses, I think, is that we need to be careful that, patients may be transferred to our facilities from a different facility because that facility was impacted. So again, having that awareness, and always, doing our assessment of patients, trying to understand why treatment may have been delayed or why treatment was interrupted, and understanding the impact of climate, and start documenting. Because I think one of the things is that we often don't document. We just accept, let's say, a transfer patient, but don't really investigate why was that transfer there. And I think once we have more data, it would be easier perhaps to convince systems to prepare better for when it comes. Yeah.
And if I can just add on to Stella, because she raised another great point that, oftentimes these disasters are driving displacement, driving migration. And as healthcare communities, we have to be equipped to be able to serve these diverse communities that maybe we weren't serving even a year ago. So we have to kind of keep a finger on the pulse of the communities we serve. We have to invest in interpretive services, and resources that are reaching these communities that oftentimes fall through the cracks during times of displacement, during times of disaster. So I just wanted to add that on.
Yeah.
Thank you for that. There are several more questions, and actually a couple of questions. The participants would like to have some feedback on the cost, and what can oncology care being very expensive and complicated in the global south, and really not just in the global south, but I think across the globe. How can this burden best be reduced, and do you have any suggestions or recommendations or something that even just we can do as an individual, as a person and a member of our community, as a person, policy wise, nationwide, internationally, just some practical suggestions would be
Yeah.
you can offer some of them.
Yeah, maybe I'll start on this one and then Ashley. It is I'm old and this has been an issue for decades. So it's a challenge that has happened. And I think there are a couple of initiatives that I think nurses could support. So one of the things that have been proposed, the United Nations just completed the UN summit on non-communicable diseases and included access to treatment for cancer as part of some of the goals and targets. So there are a couple of initiatives. One with a group that I work with, the Union International for Cancer Control, and it's called ATOM. And the idea is to work with pharmaceutical companies to make certain cancer medications available for middle and low income countries at low or no cost. So that's an initiative partnering with some pharmaceutical companies to make some of that accessibility. The second mechanism that has been promoted that encounters some political barriers, and that's what I think nurses could really engage in advocacy, is taxing harmful commodities and using the tax and earmark the tax for healthcare. So, for example, increase the tax of tobacco products, increase the tax on sugar beverages, increase the taxes on alcohol, products that we know cause harm to health, not just cancer, but harm to health in a broader way, and earmark these taxes towards not just healthcare assistance, but work more on prevention. So of course, it has to be. We need not to always be making the choice prevention or treatment. That's a false dichotomy. We need to both. We need prevention, we need screening, and we need treatment. We need all of the above. So one of the systems that has been proposed that both would decrease consumption of these harmful products and increase revenues is working to increase taxes and earmark some of these taxes towards healthcare systems, including cancer.
And Ashley, did you have anything to add to that?
I think Stella answered that really concisely and thoroughly. But one thing I will just add is, I know it can be really frustrating as nursing advocates who are very, very passionate about climate change and the impact on human health when we're dealing with policy leaders. And in a world that so oftentimes it feels like values saving dollars over saving human lives. And I know that's not the case, but sometimes, um, money speaks. And so sometimes, sadly, that's the language as advocates that we have to speak. And I just want to mention, since we're talking about costs, the impacts of climate change is significantly costly. I don't have slides right in front of me to share, but from 2022 alone, in the US, there were over 14 natural disasters that exceeded $1 billion in cost for their communities. And, this not only impacts hospital systems, but it has long-lasting economic impacts on communities as well. And so I guess I just bring that back to, as nurses, we have to, as we advocate, the research is out there, the information is out there, and it's really our responsibility to communicate that as we advocate for change. And sometimes money does speak. So anyway, I just wanted to mention that.
Thank you. And maybe what might be helpful for our participants is some of those resources that you mentioned on prevention and where we can engage in policy. Maybe we can share those with in our resources for the course, because I think that just having that direct link to something that a nurse can do in their own communities really might help to engage our participants, no matter where they are. And I would like to also extend that to the participants on this course. We are a global community here, and if you have any resources in your communities, please share them with us so that we can all be working together, because this is not just an issue in one part of our globe. It is a issue that spans across the entire world. So please share your resources. Please reach out to us on WhatsApp. We would love to be able to share that. And so thank you so much to our speakers today. That was a wonderful, wonderful discussion. We are out of time. And I'd like to just thank you all for joining us today from across the globe. Please join us again next week for session 8. My goodness, it's going by quickly. It is going to be on climate and gender-based violence, and we will see you all here next week. And please reach out to us on our WhatsApp. Please reach out to us on our learning platform, and any of your suggestions. We are always so happy to learn. So thank you all. Have a wonderful day. Adios. Have a great day. Ciao. Bye-bye. Thanks,
Thank you.
everyone.
Bye bye.
Bye-bye.